Well, hi everyone. It's June 5th, and I'm very, very happy to be home here in Anchorage and have been since Mother's Day. So today I wanted to talk to you about something that I think a lot of you who are parents, I am certainly a mom and a grandmother, a subject that I think you're as concerned about as I am, and that is the commercialization of marijuana that's happened and what its implications are for our kids. So one of the bills that I passed this last session was the Marijuana Prevention and Education Fund. And I just wanted to talk to you a little bit about what that is. We began retail sales of marijuana out of storefronts in 2016. So the Division of Public Health has actually looked at what use of marijuana looks like in Alaska in 2017. So this is the survey data that they had. We know that the highest use group of Alaskans are age 25 through 34. 15% of Alaskans reported in a month during 2017 using marijuana, so 15%. 24% of that were Alaskan Native adults. So that's interesting. But what about kids? So after alcohol, marijuana is the second most common substance that high school students report using. High school students who report ever having used marijuana, 42%. This is the number in 2017. 56% of Alaska Native teenagers report having used marijuana. And interestingly, 44% of female teenagers, so actually higher than the average, is being used by females. 11% of kids report having tried marijuana before the age of 13. That's an important thing to think about. We have ample evidence, and I'm going to talk to you about Boston Children's Hospital and some addiction specialists there who have that substantial evidence that the use of marijuana under the age of actually about 22 to 24 years of age substantially changes how the brain works. We know that the use by teenagers of marijuana changes their ability to remember and their ability to learn. Compared to kids who do not use marijuana, depression is 2 times more common in kids using marijuana. Suicidal ideation is 3 times as prevalent. And actually, suicide attempts is 4 times more prevalent in kids who are using marijuana compared to kids who do not. So what is the school district seeing? You know, I'm telling you that the Division of Public Health is identifying that not only kids under the age of 13, but our teenagers are using marijuana. So what does the Anchorage School District see? Well, actually, there was an article in the Anchorage Daily News not too long ago that reported in 2016, well, actually data from 2015, 16, and 17. In 2015, they suspended 69 students for either bringing marijuana to school or using it in school. So 69 students. The following year, 97 students. And last year, 166 students were suspended. Increasing numbers. But here's one that is really concerning to me. I mean, the teenagers, the older high school kids, concerning, but the middle school students. I'm a nurse practitioner, and I volunteer in one of our public middle schools. So this is a population that I interact with and am very concerned about. In 2015, 1 middle school student was suspended for bringing marijuana or using it in school. The following year, 10 students, and last year, 26 middle school students. We can see that increasingly the younger kids are experimenting with marijuana. So let me talk to you about Boston Children's Hospital. There are some addiction specialists there. And the experience they have, and believe me, this is a referral center, so they're seeing lots of kids. Adolescents who use marijuana are also more likely to misuse prescription opioid medications. They say, in our experience, nearly all our patients with opioid addiction first used marijuana heavily. They go on to say that this significantly affects how kids function when they're using marijuana. It affects their brain for a very long time, sometimes permanently, in terms of their ability to critically think and to learn and to remember. So, going even younger than middle school, let's talk about newborn and preborn children. The data that we know here in the state of Alaska is that 6% of pregnant women report smoking marijuana during pregnancy. 8% report using it after delivery. Typically, this time period, these moms are breastfeeding. We know that THC, the active component of marijuana, does pass to the unborn baby, and it also passes through the breast milk. There is no safe amount of THC for an infant. So, what about this bill that I passed? It mirrors the tobacco use education and cessation program that the Division of Public Health has been operating for a very long time. Through that program, we've identified clearly some protective factors for kids that serve to protect them from turning to substances. One of the key ones, interestingly, is a caring teacher. The data demonstrates that there's a 52% less likelihood of a kid starting to use marijuana if they have a caring teacher that they are interacting with. Parents, 29% of engaged parents help reduce the likelihood that their children will turn to using marijuana, tobacco, or alcohol. After-school programs have that same impact, and so that's one of the things that my bill addresses. We are collecting taxes on marijuana sales. It's estimated this year it'll be about $10 million. 50% of that money will go to recidivism programs. In other words, addressing folks in the criminal justice system who have addiction issues. The money will be dedicated to helping them kick that habit. 25% of that $10 million, or $2.5 million, will be dedicated to this marijuana education and prevention fund. So it will be offering grants to those after-school programs that have been shown to be so effective. They'll also be developing education materials that folks like myself, healthcare providers, can use as we interact with kids. They'll be doing surveys about kids choosing to use marijuana, what kind of understanding do they have of the impacts of the drug. So that's the goal of this fund. You may be doing the math in your head and wondering what happens to that other 25% of the tax money. That money will go into the general fund. So I just wanted you to know I share parents' concerns about the availability of marijuana and the potential of our kids thinking now that this is legal, they should give it a try. We are hoping very much to educate our kids, just as we've done with smoking. You know, as I interact with middle school students in a healthcare setting, in a school-based clinic, and I ask them about cigarette smoking, it is very, very, very common for them to smile and say, no, they don't smoke cigarettes. Then I ask them about drinking alcohol. Again, the common reaction I get is a smile or even a laugh, and the answer of no. So I would like to have that same reaction when I ask them about marijuana use, and that will happen as we educate our kids and keep them in healthy activities and interacting in healthy ways with parents, caring teachers, community activities, and after-school programs. Thanks very much for watching. See you again next time.